Well, new advances are transforming how we understand, diagnose, and treat cancer, focusing on changes in the DNA of the tumor rather than where the cancer appears in the body. Dr. Marcia Brose and cancer patient Nicole Miller are joining us to talk about a new diagnosis called TRK fusion cancer, a breakthrough treatment to raise awareness about genomic testing. Welcome to the show.
Thanks for having us.
Doc,
Pleasure to be here.
Doc, let me start with you. What exactly is genomic testing and how is it changing the course of cancer treatment?
So genomic testing is what we do when we want to identify what were the changes in the tumor itself that made it become a cancer. And so genomic testing is when we actually send a piece of that tumor out and look for what is the genetic alteration inside that tumor. And these genetic alterations can happen across tumor types and no matter what age of the patient. So these are underlying, broad spectrum types of changes.
All right, and then follow up, let's explain TRK fusion cancer.
Great. So TRK fusion cancer is basically when the gene, the TRK gene, TRK gene, is broken off in the genome and put together with another gene. And because of that alteration in the cancer, what happens is that cancer, that gene now turns on when it shouldn't and causes the cancer cells to multiply.
Nicole, I appreciate you being here to share your story, but tell me a little bit about your journey so far.
Thanks for having me. I am glad to have the opportunity. Back in September of 2014, I had a lump in my thigh and went to my doctor to see what it was. The initial testing that we did came back as a soft tissue sarcoma. So we did what everybody knows as the traditional treatments for cancer, chemotherapy, and then had my tumor removed surgically. While I was in the hospital recovering from the surgery, however, the CT scan showed that it had moved to my lungs. So even though we thought the journey was over, yay, we're done, we found out that it had moved on and infected my lungs. From there, it grew rapidly. By February, I was in a wheelchair and on oxygen, and we didn't know what else to do. So my doctor at the time, she looked back at the initial testing that I had, and she found that I had this TRK fusion in my tumor, and was able to find a clinical trial in Denver for me that matched a treatment to this cancer. So I went to the cancer site. We stayed there for 6 weeks. And from having been on oxygen, by the end of 6 weeks, I was able to go horseback riding with my family.
Wow. Wow, that is absolutely remarkable. Doc, tell me about this in the time we have left. What's this breakthrough treatment that she received? How do people out there watching find out more about it?
So she had a drug called larotrectinib that directly targets that. But what you have to do is you have to go to your oncologist, ask for testing, and they will find out if you have an option to have one of these drugs.
Wow, Nicole, that is such a great story. I'm so happy for you and your family. For anybody out there who might be dealing with some kind of cancer right now, what do you have to say to them?
Don't give up hope. There's new things coming out all the time. The research is fascinating, and this type of treatment, this targeted precision treatment, is the way things are going forward, and the results are remarkable. And so definitely talk to your doctors.
Absolutely. Thank you so much for sharing your story. Thanks for being with us. Where can people find more information again, Doc?
Yeah, they should just ask their oncologist to get their genetics on their cancers.
Thanks so much for joining us. You guys have a great day.
Thank you.
Thanks for having us.
Remarkable stuff. Thanks to Bayer for bringing us that interview.